Good evening, friends. We are back with a brand new episode of BMC Global Live Al-Hilal Health World. Nothing but lifestyle. Health is a relationship that you have with your body. If that is going great, life becomes smooth sailing. But the reality is, we all encounter health problems at some point or the other in our lives. And back pain is one such very common problem that a lot of us grapple with on a day-to-day basis. It can actually restrict our movements and can hamper a normal, healthy lifestyle. To discuss this issue of lower back pain, we have with us today Dr. Pankaj Joshi, specialist orthopedic surgeon from Al-Hilal Hospital, Muharraq. Dr. Joshi has over 15 years of experience in orthopedics, and his area of expertise is spine disorder treatment, complex fractural procedures, and of course, lower back pain management. Thank you for joining us on the show,
Thanks.
Doctor.
Thanks for inviting.
Pleasure to have you with us. Can we begin by discussing what are the basic root causes of back pain?
Low back pain is a very wide subject. Among that, predisposing factors. Number one is a posture for the back pain. Second is a degenerative spine, like age-wise changes in the backbones. Third is like traumatic, any injury in the back pain. Lumbar spine area, you bend forward or any accidents. The fourth one is like idiopathic, means causes are not known, like infections are there, like tumors are there, many miscellaneous conditions, they also causes the back pain. But golden number one cause is the posture.
The way you sit.
Yes, that's nowadays very important, because in our consulting areas we saw 70 to 80% of patient came with the postural low back pain.
And what are the other factors that aggravate back pain generally?
Second thing, like lack of exercises, weak muscles, additional like how you sleep, which kind of bed mattresses you uses. Third thing, like your work patterns, what kind of work you do. Definitely that hampers your back pain more. Very important thing, like any person suffering with back pain, no need to be nervous, because stress is one of the factor adding to the more back pain. So we observe, like any patient come with the low back pain, he is afraid of many things. So I need to inform this kind of patient, like don't get scared of that thing, because scare, worry, these things add more pain in the low back pain. Study says like low back pain get more aggravated with the worry. So leave the worry in the home and be relaxed with the back pain. Treatment is very easy for low back pain, and the posture, if you maintain, 70-80% of back pain relieves.
So once you get back pain, what are the factors that we have to keep in mind so that it doesn't get worse?
Number one thing, suppose any person came with the back pain, he says like, doctor, I have the only today morning get up and start back pain. But no, the story starts from the 3-2 weeks behind. Like as I told, the posture, or somewhere the disc issues, the muscle fatigue, they started. We ignored the things, and that aggravate the back pain one day, like a super factor like back pain, and the patient got alarming symptoms like, I can't bend, doctor. I was just get up from the bed and I got a back pain. So that's an additional factor, and the root causes, as I mentioned there, that's a story for the low back pain presenting in the hospitals.
And doctor, you mentioned about stress. Now, stress is a part and parcel of our lives. So what role does stress play in back pain? Does it actually have a direct impact on your back pain?
Yeah, your question have the elaborative answer, but as an interview I give short answers. In the back pain, the story start like a posture, but additional, some people sit long times and that got muscle fatigue, and the stressful evidences says like a brain related factors, hormone releases, and that add to the muscle tightness more. The stress, the brain involvement, stress induce hormones releases, and that aggravate the back pain. That's a link between the stress and the back pain. Yes, you can have the meditations, muscle exercises, and keep your body fit at least half an hour. World Health Organization says at least half an hour you keep your body active in the form of exercises, upper limb exercise, lower limb exercise, so your muscle will be relaxed. Yeah, definitely if you go for half an hour exercise, any kind of exercise, forget about the back pain story, but any kind of exercise you do, the stress level of the human being reduced to 70%, and definitely it will help in the acute cases of back pain, so you will not expose to the back pain.
Okay, so exercising is very important and keeping oneself calm, not to
Yes,
take too
yes,
much
definitely.
of stress. Okay, and doctor, could you tell us what are the treatment options available for back pain?
For example, patient of back pain, doctor, I got unbearable pain, doctor, do what you want to do. So the message is like, first, be calm, pain score can be reduced. Pain score means we have the pain scale from 0 to 100. Pain scale can be possible 50, 60, 70. So patient came to the hospital, we have the categorize the patient like a mild pain, moderate pain and the severe pain. So we categorize the patient which kind of pain score he have. In the acute severe back pain, the first thing is the bed rest you can take in the home. Bed rest is main treatment to relax the back muscles. Second thing, like when you attend in doctors, we exposed to the painkiller medications, muscle relaxant tablets and some injection modalities, number one. Number two, physiotherapy have the really excellent role to relax the back muscles. Basically pain generate 80% from the back muscles. Bone, forget about the bone, but the muscles are main cause for the paining. So if you relax the muscles with the bed rest, second thing, hot back fomentation in the home, before attending the clinic, you can solve your 50-60% of back pain. And be relaxed, there is no any danger if you have the back pain. It can settle within 24 to 48 hours.
So when it comes to pain management, like what you suggested, physiotherapy and bed rest and hot water fermentation will really help a lot.
The next story I want to add in that, like suppose patient says, doctor, I don't get better at all with your painkillers or injections or the tablet. So we go with investigation, as you asked me, investigation modality in the form of X-rays, CT scan and MRI scan. Behind the story of evaluation, we need to know whether any disc issue or some bone pathology or muscle pathology behind your back pain. Usually 95% of back pain they settle within 24 to 48
hours with mild medication.
Mild medication and the rest.
But in cases where the patients have acute back pain and you decide that they have to go in for surgery, what are the risks and the benefits associated with going in for a surgical procedure?
Yeah, there are, we call it the red flag alarming sign. In that cases, only surgery we suggest. Yes, definitely the CT scan, MRI scan, we give the guideline for the surgery, how much bad disc pressing on spinal cord, but patient should know that in which kind of indication surgery happening. So red flag sign is like unbearable pain, like I'm dying kind of pain, which is not responding to the injections, bed rest and physiotherapy. Second is your power become less in the lower limb, like a paralysis, or I can't move the leg also. Third thing is your urinary controls gone. At that time, patient says, doctor, I want to go to bathroom, I want to pee, but I can't pass the urine. In this red flag sign, I'll repeat again, the severe unbearable back pain, which is life-threatening pain, which is not responding to the painkillers, not responding to the physiotherapy. Second is paralysis in one of the leg, and third thing like urinary control goes. Only in these three criteria, red flag sign, there is surgery required. Apart from that, there is no role of surgery in kind of simple back pain.
Okay, so it can be managed with medicines is what you're trying to say. So what are the medicines and what effect and impact does it have on back?
When you go to doctor, give them many medicines. So I want to just elaborate in short. Number one thing is pain score. Any patient have the pain 70, 80, we suggest to take strong painkillers at least for 3 weeks. The muscle relaxant also for 3 weeks. And some vitamin supplement for the nerve, vitamin supplement for the back to improve the quality of bones. As I told, like weak bones, disease degenerative in the beginning as a predisposing factor, root cause. That has to treat, then indirectly it will reduce the pain. Any patient taking excessive painkillers more than 3 weeks or 3 months, it will be super add for the kidney, and everybody knows like painkillers and the kidney are the enemies of each other. So any person have the pain, back pain more than 3 weeks, ignore the taking painkillers and consult your doctor to get the root cause and treat properly with other modalities like physiotherapies are there to get definitely ensure reducing the back pain.
you spoke about some side effects of medicines. Doctor, could you please elaborate on that? Because in certain cases, we have observed that the medicines have to be taken for a long period of time. So what are the harmful impact and what are the side effects of these medicines that one has to keep in mind?
Yeah, number one thing, when you're taking any painkillers, always read the pamphlet behind the painkillers, how to take it. Yes, doctor will advise, but definitely be alert. Second thing, any person on the hypertensive medicines or diabetic medicines or thyroid medicine, inform to your doctor like I'm taking so and so medicine, so it will be easy to treat. And as a side effect of medicines, every person has to be ensured like I don't have like other allergic reactions, swelling on the legs. If it is there, you inform to your doctor, concerned doctor. As a side effect of medicines, kidney failures are very more with painkillers. Second thing, like skin reactions with the painkillers, lot of muscle relaxant make like a calf fatigue, crampings in the muscles. So such kind of side effect. Apart from that, if you really not have relieved the pain, some patient we give special painkillers at least for few months. In case of like they said no, I want painkiller, I don't want physiotherapy. So we counsel the patient like every 3 to 4 weekly, have the kidney and the liver level has to be screened. Once green signal like kidney and the liver is okay in the blood test, you can go ahead with painkillers. But depending on the pain, like if pain is unbearable, only you take the painkillers. Otherwise, nowadays the perception of pain is very sensitive. Simple pain also we want a painkiller. So my advice for my friends, like if you have the mild kind of pain, just ignore the painkiller, do the bed rest, apply the hot fomentation, and if not settling, consult your doctor to take like a reliable and assurance for the painkiller.
Okay, so your advice is to avoid painkillers as much as possible.
Much as possible, yes.
Okay, and other than medicines and surgery, are there alternative treatment options available for back pain?
Gone through the investigation part. MRI is nowadays the best modality of investigation. It will classify the patient whether it required to be have the physiotherapy or some chiropractic exercises for the back muscles. We categorize the patient and accordingly we go with the treatment. So the question as you asked, like apart from surgery and the medicine, other modality of treatment. So the physiotherapy is the number one advice for the relieve the muscle spasm. But apart from physiotherapy, there are back extension exercises which patient has to perform himself in the home, and that has to take long time to develop the muscles. So as I explained you the causes for the back pain, see the backbone is only the 40% chunk of the body. The 60% chunk is the muscles. So 60 is more than the 40. If you develop your back muscles, so your back pain will reduce by 70%. Yes, it has to do the exercise properly with guidance with the orthopedic surgeon plus physiotherapist. Don't go with yourself for the exercise. Sometimes there is a risk like the pain may aggravate and you do some wrong exercise for the wrong disease of the back.
So the always be done under the guidance of
the guidance of the physiotherapist, correct ma'am.
Yes.
And the physiotherapist definitely help you to teach which kind of exercise to be performed. And if you do the exercise for more than 6 months, your 80-90% of back pain will not be there. Recurrence story is there for the back pain. So I say, I give the good word for that. If you maintain your back muscles all life, there is no risk for your back pain in the life.
Doctor, any special tips for the IT sector professionals or those who sit in the office in front of the computer for a long period of time, because these people, I've seen they're more prone to having backaches. So any special advice to them on how to take care of this issue?
Yes, good question. Nowadays, rise of 21st century for the IT people. So many out of 100 people coming back pain, 70% of people from the IT sectors. Number one is the posture. Posture of the IT people has to be rectified immediately. If you are listening, when you are sitting, not like a stooping posture on the computer, you should like erect spine, and your chin will be at a screen level. Your chin will be at a screen level. The back pain is not a different animal and the neck is not different animal. Has to be considered the neck is your part of your back. If you keep the chin at your screen level, so you can have the relax your neck, automatically it affect on the lower back. And every 30 minutes, take the break for 7 to 8 minutes. Suppose you are sitting in the computer for 30 minutes, you take a break for 7 to 8 minutes, have the walk for like 5 to 7 minutes, relax your lower limbs, then you sit again. Your chair should be upright, and you should have support or hunchback on your back muscles. You can have small pillow behind your back, and your neck should be resting on your chair. And I repeat again, your chin should be at a screen level.
Screen level.
That affects because if you're bending the neck long time, the neck muscle fatigue, automatically the back muscle fatigues. And take a break for 5 to 7 minutes, not for the back pain prevention. It is good for your lower limb calf muscles. Some people sitting long time, they develop like a deep vein thrombosis also. So I want to tell, keep active 5 to 7 minute walking and 30-minute working and 7-minute break compulsory. So it will reduce the exposure for the back pain, even for the neck pain also.
Doctor, we are coming to the end of this episode. So can you share a takeaway message for all our viewers? And if you could just take us through whatever we discussed in this episode about how lower back pain can be managed and whatever we discussed in this.
First thing, low back pain, nothing to worry. Number two, when you come to like exposing the back pain, a morning time get up, no need to worry. Take a bed rest, apply the hot fomentation, contact your nearest orthopedic surgeon. Like next thing, attending doctor, they will treat you with the painkillers, muscle relaxants, and the physiotherapy. Apart from that physiotherapy, if not settling, then doing the MRI scan to evaluate like how much damage in the disc, and accordingly we can treat the patient with physiotherapy and the medication. If not so, the surgery is also available in Alhilal Hospital, Muharraq, where team of doctors we treat with spine cases and where the outcome is very good. So surgery is only, as I told, like for 5 to 6% of people.
As the last resort.
As the last resort, nothing to worry for that. But don't ignore the back pain. If mild to moderate back pain, like my score is 40, 50 back pain, don't ignore. It's alarming sign. You immediately meet doctors, orthopedic surgeons, and get diagnosed first. And the treatment is very easy. It is not like some unknown treatment for that. Yes, we have the treatment modalities available in Alhilal Hospital, Muharraq, in the form of physiotherapy, X-rays, CT scan, and the MRI. And nowadays, world is very fast moving, so don't ignore the things. Don't take granted like chalta hai kind of attitude for the back pain. Yeah, get attended to the orthopedic surgeon, and the treatment very easy in early case. If you delay the treatment, it is degenerative spine get more damage. So the relief from the pain will be very poor if you delay the things. Especially in diabetics and hypertensive patient, I want to tell my friends, like if you have the acute back pain, don't ignore for 2 weeks, 3 weeks, 4 weeks, immediately consult doctor and get treat the back pain so you have the healthy and the beautiful life.
Thank you, doctor, for joining us on this show, and thank you for those reassuring words. Friends, if you have any problem related to orthopedics, please feel free to visit Dr. Pankaj Joshi in Alhilal Hospital, Muharraq. As doctor said, make your health a priority. Exercise is not a punishment for what you ate. It is a celebration of what your body can do. So exercise regularly, eat healthy, stay fit and stay happy. Goodbye for now, but we'll meet again next week, same time, with a different topic. This is Anupama signing off. Good night and take care.